Hi, my name is Whitney Guerrero. I'll be accompanied by Amy Cannon, Valerie Boyd, Amber Kelly, Cynthia Pippins, Nana Stressla, Mallory Watson, and Emily Anders Willard. We're going to present the role competency of direct clinical practice. I'm going to begin by talking about the definition of direct clinical practice. Direct care is the central competency of advanced practice nursing. It is essential for effective consultation, collaboration, leading clinical staff, and programs. Direct care and direct clinical practice are the functions and activities that advanced practice nurses, or APNs, perform within patient-nurse interface. Patient may include significant others or family members, depends on the focus of the APN's practice. Activities are unique because they are physically and interpersonally co-enacted with patient with the purpose centered on promoting health and well-being of that particular patient. Processes occurring with direct clinical practice include the patient-provider therapeutic partnership is established, health problems become mutually understood through information gathering and effective communication, health recovery or palliative goals are expressed by the patient, management and treatment options are explored, physical acts of diagnosis, monitoring, treatment, and therapy are performed, education, support, coaching, counseling, and comfort are provided, decisions regarding future actions to be taken by each party are made, and future contact is planned. Possible occurrences in relation to direct care interface include collaboration, consultation, and mentoring of staff. An example of how to differentiate between direct and indirect clinical practice is an APN consulting with another provider regarding recommendations about the patient's care or condition. The primary purpose is to obtain information and understanding to utilize in making recommendations for the direct care provider of the patient. APN is involved in clinical practice but is not providing direct patient care. Most APNs play a role in ensuring that others are providing safe quality care via indirect practice. Different APN roles diverge when a comparison of the amount of time spent with each of the direct care activities is made. According to works by Lincoln, Scott, and Verger, many direct care activities performed are similar across APN roles and include physical examinations and assessments, patient and family education and counseling, ordering laboratory tests and medications, and performing procedures. Direct clinical practice is used by all APNs, however, variation is noted across roles, patient populations, and settings when comparing which activities are performed and how much time is spent with direct care activities.
Hi, my name is Nana Stressla, and I'm going to be talking about where the direct clinic practice falls under Hamrick's model. There are 7 core competencies of APN and Hamrick's model that defines advanced practice in each APN role. Those 7 core competencies are direct clinical practice, expert coaching and guidance, consultation, research, clinical, professional and systems leadership, collaboration, and ethical decision making. Direct clinical practice is central to and informs all of the other competencies. It's first among equals of all core competencies, and it provides the foundation necessary for APNs to execute the other competencies. Graduate level education and experimental knowledge combine to develop characteristics of APN's direct clinical practice. Complex competencies develop over time with exposure to each competency in the form of didactic content in graduate school as well as practical experiences. APN's direct clinical practice interacts with and informs all other competencies. It's indicated by openings between the central competency and additional competencies in the model. These competencies are basic elements of every APN practice. APNs are expected to show these competencies in their practice. Direct practice competency differs significantly by specialty. For example, expertise of CRNA administering anesthesia differs from expertise of NP in the clinic. Thus, direct clinical practice is a central defining characteristics rather than an expectation that APNs only engage in direct clinical practice. There are 6 distinguishing characteristics of direct clinical practice. Those are use of holistic perspective, formation of therapeutic partnership with patients, use of expert clinical thinking and skillful performance, use of reflective practice, reliance on research evidence as a guide to practice, and use of diverse health and illness management approaches.
My name is Mallory Watson, and I will be discussing the 6 characteristics. The first I will discuss is the use of holistic perspective. This includes understanding the patient and viewing them as complex and unique, and also recognizing their multiple dimensions such as biological, psychological, social, and spiritual, and recognizing that the whole is greater than the sum of its parts, and viewing the patient as an integral part of environment along with relation of body, mind, and spirit. The second trait is the formation of therapeutic partnerships with patients. The APN must incorporate the patient's beliefs and values into a shared decision-making process. The APN must determine the patient's preference for participation and tailor her communication and decision-making style to that patient's preference. Open and honest communication is also very important, and recognizing the APN's personal beliefs and values. Cultural influences also play a role in therapeutic partnerships, such as recognizing and respecting the patient's cultural identification and making sure to incorporate principles of cultural diversity into your interventions, and also making sure to avoid assumptions. When caring for a non-communicative patient, the APN must make sure to pay attention to nonverbal cues and use alternative methods to provide communication and also emotional support, such as reassurance, bodily care, pain relief, giving explanations, and the comforting touch when needed. The third trait is expert clinical thinking and skillful performance. The APN must have knowledge and critical thinking, such as using good observation and assessment skills. Thinking errors can affect this, such as using poor judgment, biases, jumping to conclusions, which can lead to premature diagnosis, and lack of listening and assessment. Time pressures can also be a factor, such as a heavy workload, feeling pressured or being rushed, cognitive overload, fatigue, and hassles such as interruptions, noise, missing supplies, and system glitches. Skillful performance includes competency through process agencies that credential and grant privileges to the APN. Guidelines for APN to perform a skill includes what the procedure will be, conditions to perform the skill, how the APN will acquire the skill, and supervision during that learning period.
Hi, I'm Cynthia Pippins, and I will be discussing the last three characteristics. Use of reflective practice explores practitioners' experiences, positive or negative, clarifies meaning, critically analyzes and synthesizes, uses learning to improve practice. Goals are turning experience into personal knowledge by seeking insight not available by superficial recall, increase self-confidence as a practitioner, and may promote accountability. Reflection can be retrospective, could situation have been handled differently? Prospective, uses experiences to plan approach and anticipate outcomes. Concurrent, reflection and action. It's the goal of the more experienced practitioner, promotes flexibility and adaptation of interventions to suit the situation. Use of evidence as a guide to practice. Research-sensitive practice is unstructured, utilizes primary research reports and summaries, informally evaluates soundness of method, adjusts to own practice based on credible findings. Research-based practice is systematic, rigorous, and precise, locating, evaluating, and summarizing the science, translating the science into clinical recommendations, which include clinical practice guidelines, decision algorithms, clinical protocol, components of clinical programs, changing in policies and procedures, and strategically implementing recommendations. Evidence-based practice is explicit and judiciously integrated of best evidence. Objective evidence used includes quality improvement data, data from internal databases, expert opinion panels, consensus statements, and data from benchmarking partners and state and national databases. Theory-based practice idea is less familiar, helps practice be more purposeful, systematic, and comprehensive. Conceptual models were more commonly used in the past. Mid-range theories are more recently utilized, address a particular patient experience or problem, guide practice more specifically. Diverse approaches to health and illness management. Interpersonal interventions are psychosocial in nature. Supportive interventions include providing reassurance, giving information, coaching, affirming, providing anticipatory guidance, guiding decision-making, listening actively, expressing understanding, and being available. Telehealth, information technologies, and direct care. Telehealth was traditionally used by physicians, helps improve access to health care in rural and isolated areas, uses computers, video cameras, faxes, and telephones. Electronic ICUs were located on-site or off-site. Nurses and intensivists provide additional monitoring. Cameras and electronic interfaces with hemodynamic monitoring and diagnostic equipment transmit to remote providers. helpful in rural and urban settings.
Hi, I'm Emily Anders Willard, and we're going to do the examples of the direct clinical practice. For our examples, we did a scenario of John Doe. John Doe, a 46-year-old overweight white male, comes to see the advanced practice nurse in a small family practice clinic. He states, "I quit taking my diabetic medicine about 3 months ago, and I'm not feeling well." Upon further questioning, the APN discovers that he was going to a busy clinic in which he did not have a consistent provider. He complains that he felt rushed each time he was seen, and no one really explained what was going on. He was tested for diabetes because he was having polyuria and polydipsia. His fasting glucose was 232, and his hemoglobin A1C was 8.7. He was prescribed metformin 500 milligrams twice a day and was told to change his diet to a diabetic diet and test his glucose daily. He took the medicine as ordered but did not know what a diabetic diet was or where to get a glucometer. He returned to the clinic to see a different doctor who increased his metformin to 1,000 milligrams twice a day, but it was never discussed his labs or why. The first example is the use of holistic perspective. The APN understands that diabetes is a multifaceted disease. It affects not only biological state, but his the APN. The first example is the use of a holistic perspective. The APN understands that diabetes is a multifaceted disease process affecting not only his biological state, but his psychological, social, and spiritual dimensions as well. The APN understands that she must be an educator as well as a supporter. She tells the patient that in order to best control the disease, he must change several aspects of his life. The patient responds by saying that's what he was afraid of, and now he will never be able to go out and eat with his friends because he can only eat sugar-free foods. The patient also begins to question his spiritual relationship by asking, why would God do this to him? The APN recognizes that the patient was afraid of losing his friends because of the diagnosis and is also experiencing spiritual conflict.
My name is Amy, and I'm going to be discussing examples of formation of therapeutic partnerships and expert clinical reasoning and skillful performance. An example of formation of therapeutic partnerships is when the APN realizes that the patient does not have a positive impression of healthcare providers and was not allowed to ever become an active participant in his own care plan. She knows that if she is going to help this patient, she must build a trusting relationship with him first. She sits down with him and explains the disease process, the importance of following a diabetic diet, keeping a log, and being compliant with the medication. Also, she informs him of the importance of working as a team, especially when the parts of the plan do not fit his lifestyle. The APN allows for time for the patient to reflect on all that she has said and then ask if he has questions. The patient responds well to the APN and asks her questions regarding his diabetic diet and discusses his concerns about taking the medication. He admitted that he should have never stopped taking the meds, but when it was increased and it gave him terrible stomach cramps and diarrhea, he had no other choice. He also states that if he had known how to control his sugars better through diet, maybe he would never have had to increase his medication. An example of expert clinical reasoning and skillful performance can be seen when the APN uses her clinical knowledge and realizes that medication should not be the only therapeutic action for this patient. They discuss non-pharmacological approaches, including diet and exercise. She explains that intentional weight loss in patients with type 2 diabetes will often result in reduced clinical symptoms and mortality risk. They agreed to reduce the metformin to 500 milligrams BID, follow a diabetic diet, and keep a log. And he needs to return to the clinic in 3 weeks to review his progress. The APN also encourages that the patient read the provided pamphlets and write down any additional questions that he may have. At the next visit, she will be sure to allow adequate time to answer questions and time for further unhurried education.
My name is Amber Kelly, and I'm going to discuss the use of evidence as a guide to practice. The APN suggests that the patient having a diabetic eye exam. She explains to him that some research shows that retinopathy in newly diagnosed diabetic patients can be as high as 20%. The patient states that he never considered eye problems to be associated with diabetes. The APN shows the patient a research article on her iPad and suggests that he have the exam done. The patient agrees to have the exam and is excited to do so. The APN delivers approaches to health
through a diverse approach to health and illness management. The APN uses supportive interpersonal interventions throughout their interaction in the form of actively listening, giving information, coaching, providing guidance, and coordinating services with the other providers. This is seen when the APN schedules the eye exam with a specialized diabetic eye healthcare provider. The APN tells the patient that she believes that he has what it takes to control this disease. The patient excitedly agrees and asks if there's anything else that he can do. The APN suggests a diabetic meal planning group to help with meal planning ideas. The duo decides that getting his wife involved in the meal planning class would be very beneficial. The patient admits that the class may also be something fun that him and his wife can do together. Finally, the APN uses reflective practice. This is seen when the APN begins to think about all the patients that she may have not taken as much time with in the past. She identified that rushing through appointments could prove to be detrimental for her patient's overall well-being. The APN realizes how one bad interaction can have such a negative impact on the health of her patients. The APN decides to discuss this experience with other providers in her practice, and they agree that the quantity of their patients may have negatively affected the quality of care. She learned from this experience and vows to strive to provide care to her patients with all the components that the advanced practice nurse needs to provide.
I'm Valerie Boyd, and I'm going to discuss current research of clinical experience and the role of the APN. Clinical experience was limited for a long while. It was only recently that nurses of all levels were allowed to actually participate in the clinical process in any sort of meaningful manner. This new development illustrates how important APNs are in the actual field. Clinical experience is an absolute must for all advanced nurse practitioners because it gives them the experience they need to push forward with innovative thinking that can help solve real health issues and prevent future ones from plaguing patients later in life. According to the research, direct clinical practice is a core competency of any APN role, although the actual skill set varies according to the needs of the patient population. For any specialty or role, the clinical experience is an absolute necessity because it empowers the APN to make better decisions and create more innovative health solutions for patients and patient populations in need. Clinical experience is raw, real, and uncut. Benefits of the current research include preparedness. The APN is prepared to assume responsibility and accountability for health promotion in the assessment, diagnosis, and management of patient problems, including the use of prescription and pharmacological and non-pharmacological interventions. Clinical prevention, health promotion, and risk reduction/illness prevention for individuals and families. Here, the research suggests the implementation of clinical prevention and population health activities is central to achieving the national goal of improving the health status of the population of the United States. With so many Americans living unhealthy lifestyles, it is now the responsibility of the APN to draw upon his or her clinical practice in order to implement prevention strategies at all levels, from convincing an individual patient to make healthier life choices to developing community-based prevention programs. Acquisition of new skill sets. To provide innovative solutions in the real world, in the modern world, the APN must demonstrate specific clinical performance and patient outcomes. As such, the APN must draw on clinical experience to improve the status of their patients, but also the entire healthcare situation as a whole. Thus, they must engage in direct clinical practice, function as consultants in their area of expertise, provide expert coaching and guidance, interpret, evaluate, and participate in research, provide clinical and professional leadership, collaborate, and employ ethical decision-making. In conclusion, without clinical experience, the APN is lacking in the real-world skill sets that would allow them to make innovative decisions within the field. Clinical experience keeps APNs at the forefront of the medical field, which is also crucial for innovation. Clinical practice is what serves as the basis for the depth of knowledge that would allow an APN to succeed in developing successful prevention strategies. The APN can use his or her clinical experience to create new prevention strategies that are more tailored to the specific patient population he or she is servicing.